Next is Chapter 18, Symptoms, Signs, and Abnormal Clinical and Laboratory Findings Not Elsewhere Classified, or NEC. These are R codes, R00 to R99. So we've talked about these a little bit just in terms of sequencing. Again, if there is a definitive condition, then we don't need to worry about coding the signs and symptoms separately. But if there's not a definitive condition, then we can code signs and symptoms, so they can be a principal or first listed diagnosis, or they could be an additional diagnosis. They do have a lot of combination codes, which is kind of nice, so use those if they're available. There's a few just really specific guidelines out of this chapter. The falls R29.6 repeated falls and Z91.81 history of falling. This is for a patient that has recently fallen and they're looking for the reason for that fall. This would be a patient with a history of falling, so these can be assigned together. A patient could be assigned to both of those. We do have the Glasgow Coma Scale now. Not that we didn't have the Coma Scale before. We have codes to specify the level of Glasgow Coma Scale. Let me just show those to you really quickly here. So we're in the R40.2 subcategory of coma, and then you'll notice here when we get down to .21, 22, and 23, we have the coma scale for eyes, verbal, and motor, and then we have the different levels underneath that. So these are really nice for like trauma registries. I've talked to a few people at the trauma registry that are pretty excited. Assuming that we can find the documentation to code these. So you'll notice that they do all require a 7th character extension, and this is to indicate at what time the coma scale was done. So was it in the field, at hospital admission, etc. So when these are coded, you should have the same 7th character on all of them. They should have all been done at the same time. Oh, and just a quick mention, those are additional diagnoses. They would be sequenced in addition to any of your other injury codes. Functional quadriplegia, R53.2, just to note that this is for extreme debility rather than a neurologic deficit. We've talked about sepsis due to an infectious process. We also have SIRS due to non-infectious process, so that's R65.10 if there's no organ dysfunction, and then .11 if there is organ dysfunction. So your underlying condition is going to be sequenced first, and then that SIRS code afterwards. We also still have an kind of a not otherwise specified death code, R99, just that we really have no known cause of mortality there. And here's our practice question, loss of appetite. So let's take a quick look here. I'm still on my last example. I'm guessing appetite appears less frequently than loss. So here's appetite, lack or loss. We get R63.0. Take a quick look at that. So here we're under symptoms and signs concerning food and fluid intake, anorexia, aka loss of appetite. Notice this is different than anorexia nervosa, which has a psychological component to it. So we get R63.0.